to go to work because some of the situations at work, or patients passing away, or, you know, I know it has to get rough at work sometimes. I know it ain't easy going in every day dealing with the patients or whatnot, because I know in the healthcare field it's kind of rough.
Well, especially after COVID, the turn of the healthcare sector has definitely taken a downside and a downfall, and it's really at the disadvantage to the patients, you know. But that's if you get into healthcare, the patients and the people should be your heart, and so that's why, you know, you have to sacrifice yourself if that's something that you want to do. But it definitely takes a toll on you. It's definitely hard on your body. It's definitely mentally draining, and I mean, but if this is where your mind space is, and this is really what you want to do, and you're an advocate for your patients, then you're gonna jump all in and do it.
Cool. So have you had any sleepless nights because
Well,
of some of the things that goes on at your job or whatnot?
well, I can tell you about when I lost my first patient. Okay, so I had never, you know, I'd seen death firsthand with my grandmother, my grandfather, my mother. You know, my mother passed away when I was 16. So I had seen death firsthand, but when I lost my first patient that I was actually nursing, when I came upon him and he was dead, and I tried to resuscitate him and I couldn't bring him back, it took a toll on me, and it made me wonder if this was the right, you know, career path for me. Should I have been doing this? Is there something different that I could have done that could have preserved or saved his life? And that's why I was very lucky to have my mother-in-law, who is a nurse in Ghana. She's from, you know, she lives in Africa, but she gave me some very wise words and wisdom. She said that we are nurses and we nurse people to health, but we also nurse people to a dignified death. And so that was something that stuck with me as well, you know, to let me know that everybody's not going to come back. Everybody's not going to get better. Some people you're just supposed to care for so that they can have a smooth transition into the afterlife.
Yeah, because I remember your mama talking about that too. Are you following your mama's footsteps? Because I know your mama used to talk about how she saw people take their last breath, and it kind of got to her a little bit because, you know, you kind of grow, you know, how can I say this? You kind of get close to your patients or whatnot.
You do.
And it kind of it become family or whatnot. So does that affect you in any way? And are you following your mama's footsteps a little bit? Because she was a nurse too, right?
My mother was a CNA, and she was a private duty CNA, and she took care of people. And you do form that attachment and that bond with people. As far as what I say, following my mama's footsteps, I would say that nursing was my choice of career. Like when I graduated from high school, I went straight into college that August, and I've been pursuing nursing since then. And I went into it because of what happened to my mother. And that's something that I also wanted to talk about. As you know, my mother died of breast cancer, but she had a mastectomy where she had her breast removed, and then the cancer came back. But just due to the fact that, you know, we were from a lower socioeconomic class, she had Medicaid, you know, and then she was getting, you know, chemo treatments around the time of Robert Courtney, when they were diluting that cancer medicine and stuff like that.
Yeah, I remember that.
We couldn't prove that she got some of that medicine, but I really think with the fact that she had the mastectomy, she had the radiation and everything, and it still came back, I feel like that could have played a role. But just because she wasn't listened to, like she told them she felt another lump, she felt that something wasn't right, she felt that something was still there, and because she was just, you know, another Medicaid patient, they didn't listen. When they finally did, you know, try to biopsy and listen and see, it had metastasized to her brain and her spine and everything like that. So that's really what propelled me into wanting to go into the medical field, because I felt like we need advocates that look like us.
True. Yeah, that's a pretty deep story, man. So you think, okay, Medicaid, so you think Medicaid is kind of like a bad thing a little bit, or they should have like a regular insurance for your job, or?
No. Don't get me wrong, by no way, shape, form, or fashion. I feel like everybody should have some form of medical insurance. Every African American person, whether it's Medicaid, the marketplace, through your job, because the marketplace also